Hello, in this video I'll be giving you a quick overview of the formatting and content that should go into your preparatory report. I've been asked many questions by groups and the attempt here is to try and answer them in this demonstration. This is not going to demonstrate the entire report, but I will show you the first section and give you some notes so that you'll know how to complete the report. So we're going to work with a fictitious client we'll call Lyle Percival. And this particular preparatory report is fictitiously going to go out to people on the 20th of April 2020. So what we would have had to do before that is do some data collection. And one of the most basic forms of data collection is for us to go and get a medical checkup done. In this case, he will need to go and see his family doctor. And he just has a family doctor, Dr. I.P. Freely, and he has a dentist, and we'll have to get a dentist checkup. So you'll see that we start with the heading for the section, and we identify the doctor and the dentist, their address and phone number, the date that we went to his appointment, and when the next checkup is scheduled for. And you can see that one's like 8 months away, and his dentist appointment is 6 months away. So usually that's the window we're talking about, 6 months to a year away. We're not talking about this simply the next time that the person would go and get their prescription refilled. This portion is unique to this section of the report. You do not need to do anything like this in the other 4 domains. In those domains, you'll immediately go down to this subheading. This subheading exists in all 5 domains. So we always start with a paragraph or 2. It's quite concise, describing the last year's progress. If the person has been in the program for more than a year, they will have had a goal from the previous year, and we should reflect on whether they achieved that goal and explain why not if they didn't. And if they haven't been there for a full year, we should describe their progress since coming into the program. That also includes input from other stakeholders, such as the doctors, other family members, or the supported person, him or herself. In this case, we say Lyle wanted to improve his eyesight last year. That was his goal. And then we talk about him since acquiring a pair of progressive lens glasses and now saying he wants to get a pair of sunglasses this year. We talk about his overall health and say that he was otherwise healthy except for a few days of the flu. And so there's no real need there. And he has talked about having a desire to reduce his foot and ankle pain. Now this is quite simple. Yours might be a little bit longer given the Scott case has quite a few more, shall we say, twists and turns to it. But it's not about having something incredibly long. It's really important to remember that this document will have a couple of purposes. First, it informs people ahead of time about what you intend to discuss. And if you have something that's really long, people will not want to read it in advance. And the second thing is it's supposed to function as your agenda. So again, if it's really long, it'll be very cumbersome. So the idea that we have just a really kind of concise description of things matters. When we're using this report in the context of our agenda, we do not go back and reread all of this. We're hoping people will have done that. And I'll show you later where we really focus on what the report says. The rest we would just sort of verbally summarize. So it would be even more condensed when we go into the meeting itself because people have presumably read this. The next 2 sections are always in this order, the strengths and resources of the person. And you can see here that the resources include things like his funding source. In this case, his mother has benefits that he can access, or expertise, such as the ability to go and see a podiatrist. But it also might include internal resources, such as his motivation or his own talents or his own personal strengths that he brings to the equation. And you'll see that those have been put in pretty short, concise form. Below that, we've identified his needs, wants, and priorities. And we've said what he wants based on his own input, as well as whether it's going to be a prerequisite to other things that presumably will become important later in this report. And that's an important thing to understand, is it's not about saying things that are really long here. It's about focus and building consensus. So when we prioritize, we consider things that are prerequisites to other goals as important priorities. Of course, health and safety makes something a priority. The client's own desires make something a priority. And especially we would put needs in front of wants. So use that as your set of measuring sticks or barometers to decide what to put here. In this case, it's just a short amount. You might have a little more or even a little less. In every single section, you'll have as well these headings of the proposed long-term and short-term goals. Now, there are three things I want to focus on. The first is look at the wording. This always needs to use the word proposed or suggested because you're coming to the meeting to discuss it, and it's very important for you to let the people know that you're not telling them they have to do this. Second, I noticed that nobody has yet given me a version that uses I language. So even if our client Lyle was not able to verbalize that he wanted this, we would still use this type of language unless we had some strong objection from others. The reason is we are trying to be authentically in his head, so to speak. We're trying to truly understand what he cares about. And we might not get that information by him verbally, but we might get it from him by watching his behavior or using nonverbal communication or observing how he has behaved in certain circumstances or talking to people he knows and who trust him, who he trusts. So I have put it in red just to highlight it. It shouldn't be in red when you do it, but it should be I language. You'll also notice that this is a not Smart Plus goal. Every single section should have at least one proposed long-term goal. These are expressed in very plain language. They're very likely to be things that many of you would possess as goals. The positivity of the goal is still important, but we do not worry about concreteness. We do not worry about measurement. We do not worry about having a timeline. So we can talk about the kind of the big aspirations, the things that will make this person's life rich. Then we move into the proposed short-term goals, and I forgot to edit, so I'll do it here, the dates of these. But these are proposed goals that are Smart Plus. They're specific, measurable. They show that the need has been addressed. They're realistic, they're time-specific, and they're expressed as positives. So we heard earlier that Lyle wanted new orthotics. Looking at the process it might take to get funding and go through the process of having them fitted, I'm quite optimistic that we can have them done by November 15th. In fact, I think we'll probably be much further along than that. And speaking with doctors, they'll say, oh, well, you know what, after you wear them for a couple of weeks, your feet should feel better. So this all seems realistic, and these goals will really show me that his needs were met. So in the next section, I'm going to talk about sort of in general how you might do this, but to review this, make sure you always have a proposed long-term goal, make sure it's in I language, and make sure it is not in Smart Plus language. Proposed short-term goals still have to have proposed, still have to have I language, and they do need to be Smart Plus. But I'm asked often about whether or not there should be one in every section, and we'll get to that in our notes. So that's where we're going to go next. Every other section in the report, we've got health, safety, and fitness here, but you'll also have community, you'll have home, you'll have social and communication, and you'll have work, although not in that order. And all 5 of the sections will have these 5 subheadings of past year and current functioning, of strengths and resources, of needs, wants, and priorities, proposed long-term goal, and proposed short-term goal. Even if you ultimately don't put a proposed short-term goal there, you should have the heading, and then you'll learn from the remainder of this video what to say. So you will have at least one proposed or suggested long-term goal in every section. You'll have a total, when it comes to the short-term goals, of 3 to 5 in the entire document. A person might have more than one short-term goal in a section. Now what happens if you have 2 in one section? You either have to have more than 5, or you have to have a section without a goal. And the answer is the latter of those 2 options. So sometimes because of prioritization, we say we're going to focus on health, or we're going to focus on the workplace, but the home is pretty good this year, so we're not going to have a proposed goal. So if a person does not have a proposed goal in a particular section, you put the heading and you literally write words like this: no goal proposed this year. Something like that is going to take care of things. In some scenarios, a goal in one area will also be rich enough to demonstrate that the needs are met in more than one area. So for example, you could say that a person was going to go and do something that would improve their physical fitness in goal section number 1, but it might also demonstrate that they have improved their social life. So for example, if their goal was to complete a season of soccer, well, if you completed a season of soccer, chances are your health is good, and so is your social profile. And so when you get to the social section, you might say, beside where it says proposed short-term goal, these words: see goal number 1, or see goal in section number 1. So it's quite acceptable to have rich goals, or sometimes my colleague Karen calls them juicy goals, which I think is a great term for them. Really focus on the idea of goals that have the most possible value in a person's life. We want enrichment. If I tell you that you can go to a restaurant that has good food, but it's not very fancy, you're not going to get to visit with your friends, and I give you another place that has beautiful views, time with your friends, fantastic food, and there's some kind of adventure to it, you're going to go there every time because it's ticking more boxes. Always use I language, as I said before. So make sure, make sure that you're using them for your proposed short-term and long-term goals, even if the person is fictitiously not able, or in real life is not able to verbalize this. And one last note: you're going to find this process of creating the prep report much easier if in real life you have gone and done stakeholder research, you've looked at past daily records and charting and progress reports, and you've sat with the individual and done something that finds out their client preferences. All of those pieces will help you to know what to put in the report. That's how you come up with it. You do not sit there and just kind of create it out of your own imagination. So when we do it in the case of the fictitious client, Scott, we still need to pretend that we've had those conversations. So as a team, imagine what Mom might say. Imagine what Scott might do when you ask about his preferences. Imagine what his doctor's reports might suggest have happened to his health. Imagine what his room might look like and how he behaves when he's there. And those will be the pieces that will help you to complete this process. So hopefully this gives you a bit of a tool to help you complete the prep report and to move on from it to the meeting.